Hi, everyone. Thanks for joining us today to talk about our presentation here towards a patient-initiated research assistance program in BC, where we conduct key literature searches and key informant interviews. And my name is Ryan Fairbrother, and I'm the research assistant here working on the project. And I'll pass it over to my partner, Sunny Liu.
Thank you. My name is Sunny Liu, and I'm a patient partner with the BC Support Unit. We are here to speak to you about the result of an environmental scan currently underway to support the potential building of a patient-initiated research assistant program. The BC Support Unit is a provincial organization. Our work extends across many Indigenous lands and territories throughout British Columbia. We acknowledge with respect and humility that our Vancouver offices are located on the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. Before we start, I would like to define what we mean by patient-initiated research. This is important as different people, groups, and organizations may have different definitions for patients or how they wish to identify themselves as other than patients, a challenge that we will speak to later in this presentation. The BC Support Unit has its definitions for patients and patient-oriented research, and for our purpose, patient-initiated research is research initiated by patients who have a research question they wish to explore and who partner as integral and equal members of a research team. Next slide, please. At the request by the BC Support Unit Provincial Patient Council, we are exploring the possibility of developing a patient-initiated research assistance program. Patient-initiated research may have a significant role in patient-oriented research, as it entails not only patient engagement in studies, but direct contribution by patients to study topics relevant and important to the patient. Patients experience their conditions and needs directly, and often their observation allows them to identify possible gaps in health research, gaps that they wish to pursue. As an example, one patient partner reflected on a personal experience observed over the course of several years that her frail elderly aunt living with Alzheimer's disease in long-term care had improved mood, function, and balance after being persuaded to drink large glasses of water. She wondered if any research had been done regarding adequate hydration and function in frail elderly long-term care population. Perhaps a simple, cheap, and safe intervention might improve the quality of life and safety for others, decreasing incidence and consequences of acting out behavior and falls. She can suggest a small research project to produce data for assessment of possible system improvement, but how would she start such a project? Who should she ask for help? Where and how can she get funding? To help address these types of questions, a working group was formed to study the benefits and challenges related to patient-initiated research. Our goal is to explore the possibility of supporting patient-initiated research and to inform the design and development of a possible support program. So our working group includes 2 patient partners together with researchers from the BC Support Unit, the BC Support Unit Engagement Lead as a project lead, and a librarian consultant. Now, Ryan will now tell you more about our study methodology and findings. Ryan?
Thanks for that, Sunny. So as Sunny said, we're looking into the possibility of supporting a patient-initiated research assistance program. And for us, how do we do that? And so our project team first came up with the research question. What are the barriers, challenges, and enablers of conducting successful patient-initiated research? Our team is intended to do this project in 2 parts. The first being to conduct a literature search where we look through both published and unpublished gray literature. And the second being to have key informant interviews where we have conversations with people who have attempted, done, or supported patient-initiated research. At the culmination of these 2 parts, our output will be to create a report with recommendations on how best to support the development of a successful patient-initiated research assistance program. As was mentioned earlier, the first part of this project looked at us conducting a literature search through published literature. So to do this, we had recruited the help of our librarian, Mimi Doyle Waters, whom we provided with a couple of different key search terms to try and capture the different variety of terms that are used to describe what is patient-initiated research. And from this, we took these terms and produced 3 separate library searches for our team to look through. From these different library searches, she produced over 1,000 titles and abstracts for our team to look at. And once we made a team decision on whether or not these articles met our criteria, and we would like to choose these articles for a full text further review. Once we ended up pulling each of these articles, our team found about 10 articles that we believe meet our definition of what a project means to be patient-initiated and patient-initiated research. In addition to this published literature search where we had the help of our librarian, we conducted a gray literature search on our own, which is where we looked through work that hasn't necessarily been published in an academic journal. And to do this, we looked through the internet using a combination of both Google and Google Scholar. And we also broadened the different amounts of, or the amount of key search terms that we used to try, as I was mentioning earlier, to try and accommodate for the wide variety of terms that were used to describe this kind of work. As you might imagine, because this work is so new, there wasn't much out there. There wasn't much out there in terms of the gray literature. And as was mentioned with the published literature, we had over 1,000 articles of titles and abstracts that might have met our criteria, although it ended up only being 10. And this speaks to just how little published evidence of patient-initiated research there actually is and published out there at the moment. And we're thinking part of this could be attributed to the vocabulary actually that would define what it means to be patient-initiated research is not necessarily used consistently, and it's not necessarily speaking on the same terminology or in the same subject matter. And oftentimes, some articles that also seem very promising involved patient partners. They often focused on the research topic themselves, rather than the actual contribution of what the patient partners brought to the research team and how impactful they were on the research itself. As I mentioned, though, there were about approximately 10 articles that we found met our definition of what it means to be patient-initiated research. Our team has begun looking through these articles to try and find some benefits and challenges that have appeared across the different articles. I will preface this by saying we haven't necessarily conducted our full literature analysis to this point, but these are some of the benefits and the challenges that we're starting to see as we've begun to look through these articles in a little bit more detail. So starting off with some of the benefits, what's been apparent is that the research has been more responsive to the needs of patients, which has also led to more meaningful, practical, and implementable research. Because of the patient-initiated component and the patients being involved right from the onset, patients tend to have a stronger support of these studies. And with having patients as researchers on the research team has also led to improved recruitment, as well as better participant adherence to these research studies. In addition to this, when these patient partners, if it's a qualitative study and interviews are being conducted, it has also been seen that patient interviewers have helped elicit more honest, open answers, and as well as obtaining greater in-depth information. This work also retains patient proposers right from the onset of the work, as well as the drivers of the research. And because of this has helped patients feel a greater sense of partnership as they progress through the research project, has also led to more, again, as was mentioned, more meaningful research and a greater sense of partnership between the two parties. As with all the benefits that we've seen with this, there is also some challenges that have been presented throughout the different articles that we've seen. First and foremost, this subject is very new. The subject matter is very new. It's not very well explored, as we had seen with both our literature search and our gray literature search. As well as another thing that was mentioned was the inexperience of patient researchers. There isn't a lot of situations where patients necessarily have the proper experience with research methodologies and are working from a published academic institution. So this has been posed as a challenge. As well, in addition to this, because of this being so new, there's also an apparent lack of funding for this type of work, as well as a lack of organizational and institutional support to conduct this kind of work as well. Something that was also perceived is the possibility of bias or perception of bias due to the patient's lived experience and possible different interpretations of the data that has been presented. As we've said with us conducting our literature search, the next part of this project is to conduct key informant interviews, which I'll pass it over to Sunny because we think that this is going to be really important for us moving forward as we culminate our report.
With the completion of our literature search, the next step in our research will be completing interviews with people, including patients or groups who have attempted, done, or supported patient-initiated research. Interview questions have been co-developed by our project team, including our patient partners. We're now scheduling and conducting interviews. After the interview stage, and thereby the completion of our environmental scan, we will report to our findings to the BC Support Unit leadership. Our hope is that our findings will support the knowledge translation of our finding, for example, disseminating the report to other interested groups such as the SPORE, Patient Engagement, National Community of Practice, and inform and support the design and development of a patient-initiated research assistance program. Thank you very much.